and pleasure today to introduce Dr. Sandra Copeland. And yes, you can clap, yes. Sandra is my niece, and I'm very, very proud of her. But more than all of that, she is a nurse practitioner. She is also a teacher of the nurse practitioners at Georgia College in Milledgeville. She works with a group of doctors in Barnesville. She works at the Navicent Center, Macon. I could give you a list this long of this young lady's accomplishments, and yes, she still looks 16. Not old enough to have all of these accomplishments, but I have to tell you, she just got started early. And youthfulness just runs in her family. Anyway, just a couple of things with housekeeping. We are very flexible. We are very, it is very informal. The restroom is in the back. We have 2 people that will be taking blood pressure. Can be during or after the program. Mardine DeShazo will be taking, will have her blood pressure machine, and Charlene Muley will have her blood pressure machine. So if you want to have your blood pressure taken, one of these 2 ladies will be glad to do that. Sandra, is there anything else? Oh, there's one other thing. Be sure to turn off your cell phones or put them on silent. Afterwards, we will have a question and answer session. She would prefer to go ahead and give the information and then open the floor. So we gave you some handouts that, you know, if a question just becomes a burning question, please write it down. And then as soon as she finishes the presentation, we'll open the floor up for questions. Okay, Sandra, it's all yours.
Sorry about that.
That's what happens when my kids are listening to me also. Something else is always going on. Usually it's a text or some such. So we're used to it at our house. I have 3 teenage girls.
Can you hear? Yeah.
3 teenage girls at my house, so lots of noise going on in our house. 2 drummers, very loud in our house too. So I asked Miss Ellie to pass out these pieces of paper. One reason is I want you to be able to take notes if you want to. One of the reasons I want you to take notes is I want you to, if you have a question or you're concerned about anything I have told you, I want you to write it down, take it with you to your doctor or provider, and ask them these questions. I also recommend going to your local pharmacist who gives you the medicines and ask them questions as well. Because everybody's a little bit different in how they take their medicines, and it's best that you follow what your provider has prescribed for you, okay? But in order to do that, you have to know what you're taking and why. And all of us have heard things about medications, but I want to tell you they are as old as the beginning of time. And so I start my story with the Bible from the beginning. And I always joke that the first 5 books of the Bible are basically the CDC's policy and procedure manual. If you have ever read the first 5 books of the Bible, you will learn about hygiene. You will learn about medications. You will learn lots and lots of stuff you never really wanted to know. And as science has evolved, we have discovered the reasons why these things work, and now we call them by other names, and we have lots of organizations that claim that knowledge, but it really started in the beginning. And I just wanted to give you a couple of examples of things that started that earliest recording of what medications were used as, and they've evolved names over the years. So the first, you've heard of all of these, you just may not know how they have been used. The first one is the aloe plant. It has been used for thousands of years for lots of different things, many of the same things we use it for today. Burns, lots of skin irritations, abrasions, cuts, all of those kinds of things to heal and reduce scarring. It was also used to treat constipation. That's probably one you've not heard. Today, we still use it for things like sunburns, other types of burns. It's also used to heal rashes, moisturize the skin, treat athlete's foot. Still used to prevent scarring and those stretch marks, ladies. One of the second things from the Bible that we learn about are the bitter herbs. Now, the bitter herbs we've all read, as far as history is concerned, was used by the Israelites as part of their Passover feast. And they were instructed to eat the bitter herbs with that Passover meal. And bitter herbs is a collective term. It includes several different types of plants, including lettuce, horehound. Some of you have had horehound candy from the past. Horseradish, and coriander seeds. So those, and there are many more, but those are some examples of the bitter herbs that were used as part of that feast. And we think that's just a food that was used specifically for that. But we have learned now that those are help treat urinary tract infections, kidney stones, achy joints and gout, and other things. Maybe one of the most useful and also detrimental medicines from the beginning is the cinnamon tree. Cinnamon was considered more precious than gold in those thousands of years ago. It had lots of medicinal benefits even back then. They took the bark off the tree, extracted the oil from the bark, and usually you're hearing about this to be used as perfume. It was to be used to anoint sick individuals and or anoint dead bodies, okay, to keep the smell down. Also continued by the Egyptians and subsequent civilizations before we started embalming people. So we'll talk a little bit more about cinnamon today, and you know probably some of its benefits, but you may not know all of them. The next one is garlic, and you see that advertised everywhere. We had it for lunch today, which is why I'm standing back here, because my breath is garlic. But it was used both for food and for medicine in those early days as well, especially by the Egyptians when they were building the pyramids. We have both secular and biblical references that log this for us. Today we use it to treat heart disease, cholesterol buildup in our arteries, blood pressure, to boost the immune system, and they are exploring whether or not it actually helps prevent some types of cancer. Hyssop. Has anybody ever wondered what a hyssop is? Well, I did, because I didn't know what it was. And it's actually a mint, in the mint family. So you'll see, and I think that we have some here today, those peppermint is one of the families in the mint family, to use in our teas. It was used to rub on the skin. It was used both as fragrances as well as poor digestion. Today we have the scientific evidence that tells us that we do have benefits to treat nausea, other types of stomach issues. When you go and look at your herbal tea section in the grocery store, you'll see peppermint tea. Maybe grandma used to put that and give it to you. But it has been proven to do that. In fact, there are many specialist gastroenterologists who recommend that before some of the medications that we're doing for our stomach. So hyssop is actually a mint, and And as you guys know, probably it's a little plant, and people grow them and keep them for just such circumstances. It's also used to treat fever, the hiccups, earaches, and sinus complaints. The mustard plant, very interesting. It was the subject of one of Jesus' maybe most famous parable, mustard seed, if you guys recall that. And the reason he used the example of the mustard seed is because mustard plants grew very abundantly in Palestine, and those of you who've been over there know that, or at least have heard that. Well, we have learned today that mustard can be used for sore throats, muscle and back relaxers, Phil, and even as conditioners for your hair, ladies, and to treat damaged hair. 200 years ago, we were using it in poultices to help on your chest, back, those types of things. And yes, they are bringing some of those back. So those are some of the ones that are most common from back to the beginning. Since then, different advanced civilizations have used these and others to develop what we know today as medicine. And basically I say medicine started when men and women started playing in the dirt. So when we started tilling the soil to plant things, to take care of the animals and plants in our creation, we started learning about things. So the Egyptians used a lot of these in their advanced civilizations. The Roman Empire also cultivated hygiene and medicinal plants, etc. The Hessians, which we think is a part of Germany and Russia. We go to the Indians. We come closer to this area. Our slaves before the Civil War and after were known as the pharmacists of the day. They are the ones who carried down the verbal history from generation to generation, and they were the ones called on, the midwives and others, to go treat if there was an epidemic or a woman was having a baby and all kinds of things. Then we have old wives' tales, and you guys have heard lots of different things. We have still today, not long ago, I had this experience with a patient, a young lady who was expecting a baby. And in doing her history, she told me that she drinks, especially the last few weeks of her pregnancy, drinks dish soap, like Dawn dish soap. And I tried not to express, my confusion. And I said, well, why are you drinking dish soap? Well, because her mother told her that it would make the baby slide out easier if she swallowed dish soap. So lots of things out there that we scratch our heads at that, someone said, and it's passed down faithfully. Some things are very beneficial to us, and some, like the dish soap, not so much. And as we move, also things like castor oil. Anybody in here get a dose as a child at least once or twice a year, spring cleaning, that kind of thing. But we maybe didn't realize why. Part of the reason that we've discovered about castor oil is in third world countries, passed down, it was used to get rid of worms. So as we were growing as a nation, we were in that situation where we were exposed to pinworms and other types of worms. So that castor oil actually pushed that out of the system and was in some ways beneficial. In that day also we used leeches. I know you've read about that. And today we are reusing that. We've discovered some benefits to that. when patients have skin grafts, or maybe they have a sore on their foot or arm, or maybe they've had an accident where their fingers have been had to be surgically reattached, and they'll put the leech on the very end, just say of my finger, to make sure this finger that's been reattached gets blood flow, because that leech sucks the blood through. So these are sterile leeches, by the way. They don't go get them out of the creek and ponds. So they are sterilely used in the hospitals. So it's a little disconcerting for some of the patients to have said leech on them. But we've discovered, especially with diabetics and people who have very poor circulation, it works very well. So we are seeing lots of advances based on our past.
No. Can you pause just a minute? Joyce, y'all come on in. We're doing a presentation on medications. Y'all might enjoy it. That's probably what I think.
Till the end.
Oh, the end.
So, leeches, maybe you didn't know we used maggots as well. And how we discovered this is we had patients in personal care homes or tuberculosis hospitals or nursing homes of the day that had wounds and bed sores and bandages that didn't get changed as often as maybe they needed to. And if you know anything about maggots, they do not eat live tissue. They don't eat anything that's alive. So what they discovered was they had flies that would be around the bandages. And when they did open up the bandage, the wound would be full of maggots. Okay, and at first we're like, ugh, very disgusting. However, it's the best way to get a wound clean, because once they get to the healthy tissue, they're gone. They turn into flies and fly off because there's nothing for them to eat. They only eat the dead tissue. So we are also using sterile, not again, grown flies that are cultivated and producing those maggots to clean out wounds without having to take the patient to surgery, put them to sleep, put them at risk to surgically take that dead tissue out. So again, things that you from the past that you didn't even think about are really driving our medicine today. And then the last probably is mama and grandmama. What they did or what they said is how we pass things down from generation to generation. And I want to come back a little bit to Perry. Old Perry, new Perry, and tell you a little bit about your medical history here. You probably know about the SSS tonic, and if you don't, you need to go see Ms. Loudermilk at the museum, and you can see and learn all you want to know about the Swift family and their tonic. We were laughing a little bit about the alcohol in tonics of the day. But I want you to know that property that we're sitting on today dates back to 1823, and this is on the Coffee Cup website. You can access this, and Miss Ellie verified the historical information. So the Coffee Cup here, this property, dates back to 1823. Georgia was just going away from the Indian Territory into a settlement phase, so you had lots of trading posts, etc. Starting in the 1850s, this property was a drugstore. And then it continued for many years being a drugstore. So we were laughing at the number of physicians or doctors of the day outnumbered the lawyers outnumbered the doctors, which is saying something. But there were a lot of doctors, lots of druggists, lots of lawyers. And that's they probably all three go together. And we'll talk about that in just a second. But back in the 1830s, you had physicians, Dr. Joseph Roberts, Dr. Marshall, Dr. Cobb, none of which are listed on your historical plaque in there, the list of doctors. And these are the early 1830s to the 1850s. And you would see such advertisement and posters as this one published in 1818, advertising what is Pepto-Bismol today, Epsom salt, morphine that would come in flakes, cubes, and salts, codeine, strychnine, potassium, ammonia, salt, chloroform, ether, and what we would call mercurochrome of the day, where you were, the painting, you look like red stripes all over you from being painted with that as a child. No longer available on the market, by the way, as they've discovered that mercury is toxic. It's a good thing, because another such advertisement you would see on this drugstore would be this one, the merits of cocaine. I don't know if you guys know the merits of cocaine, so I'm going to share those with you, just in case you didn't come through the 60s movement or never had anything like it. The merits of cocaine, you can purchase in pure large crystals, pure small silky crystals and flakes, and pure powder without a prescription. There's actually a prescription for marijuana, a written out prescription for marijuana from the 1800s on some of these sites that were written out or scanned in. But a little bit later, we had a Dr. W.K. Griffin here in Perry. He moved to South Carolina, back to South Carolina in 1897 he moved his drugstore from here to there with his son-in-law and opened another one. In the February 1897, the Druggist Circular and Chemical Gazette edition, which started in Europe, because they had the chemist and they had the druggist over there. So this would be the professional journal of that day. They argued in this journal about the metric equivalencies between the United States, France, and England. So when these countries from Europe started colonizing the United States, which is today the United States, they brought their druggist and chemist society with them. So they began to publish, back as early as the 1800s, what was happening in the territory of Minnesota, Georgia, the two Floridas, all of those original territories that we had, in addition to what were already colonies by England. And that's where we see in the Georgia column the announcement about Dr. W.K. Griffin and his drugstore in Perry, Georgia. So you have some history that's still published in some form or other right here in Perry, all over the world. Other interesting things in the journal were opium, marijuana, and the alcohol in the various tonics that were cooked up in the day to treat toothaches, cough, and other pain. There were stories of the Negro folklore that made it into print, and one such in Atlanta used Uncle Remus to describe medications and the problems with them. There were articles in this circular about the awarding of damages for drugs side effects. Went through the court system of that day. So not a whole lot with the lawyers and the doctors going together and the druggists or the chemists of the day, all tied up together. So the lawsuits we see today, we didn't invent. It was started before we were even the United States. and they were also going on in Europe at the time. And another such interesting story was told in this edition. It was a woman with a prescription for cocaine, belladonna, morphine, and other substances to be made into suppositories for her husband. After it was filled by the druggist, the wife came back saying that her husband simply could not tolerate the suppositories. Also had cocaine. And we think today's medications are powerful. So understanding, and some of you know the story of Coca-Cola. You know the story of cocoa beans. So we have basically taken our environment and adapted it. We talked about some plants, but also we started using animals. The original insulins of the day were actually taken from pigs and cows. And even 25 years ago, as early as that is, we were still using pork and bovine insulin. We have evolved to this day we went to human insulin, so we took insulin from human beings and produced it to give to other human beings, thinking that with the allergies associated with the animals would be reduced, it would be more like the human body if it was a human insulin. Even better now, the new insulins are genetic. So they've taken that human insulin and broken it down by just a few genetic molecules to reduce the side effects and increase the accuracy of treating it. So that's exciting. Any ladies who have taken hormones, the original hormones were taken from pregnant horse pee and used to make your hormones. Today, thankfully, we have genetic, synthetic hormones that are better targeted for human beings. Your makeup and other things also taken from various personal body parts of animals, in case you didn't know. Yeah. Okay, so you may have heard of Digitalis or Digoxin. Many people are familiar with that. It's been around for several hundred years. It was taken from the foxglove plant, which also has a flower. The trick to this is the leaves and the flowers produce two different things. So you have to be careful what you are giving. Well, the doctors of the day didn't know that. And if you've ever watched TV on these old shows from the 1800s, you'll see that they dosed out Digitalis to patients who had heart problems. And it was basically, they were experimenting. You get this much. Well, if you have another attack, you get this much. What we know today is you have to be very specifically checked for blood work. It has to be in certain ranges. Your potassium has to be. There's lots of things that make that drug dangerous, and including the antidote. So toxicity from this medication is actually derived from the same plant that causes it. So I said we would talk about cinnamon, the cinnamon tree. Well, the bark and the oil from the bark used to make what we know as coumarin, from which we made the drug Coumadin, the blood thinner. Some people order their Coumadin online off the internet. The problem is those are being manufactured in other countries. If you do not get the right part of the bark, or you get too far into the bark, you get a separate chemical known as strychnine, rat poison. Okay, that makes you feel good. So it was known to produce liver damage, and of course people died from bleeding to death because they didn't understand what they were doing. So Europe, since 2001, has been limiting how much of that chemical can go into any of their medications. In the United States, we have not yet done that. So if you order your prescriptions from other places. You have to be very careful. So cinnamon and coumadin linked together, okay? So the important things, we talked about a little bit of background, local and around the world, but the things you need to know about your medication. And I'm gonna skip up down to the bottom. We talked about the cinnamon, the insulin, the Digitalis plant. One thing we need to understand is where our drugs are coming from. So if you do mail order, even if you mail order pharmacy inside the United States, you need to understand that some medications don't need to be put in the mail. Inhalers for asthma and COPD, most of them will say on there it needs to be a certain temperature, like room temperature. So you don't want, if you're shipping something to Georgia, it can be 100 degrees, especially in the mail truck riding around to your mailbox, or other types of products when it's cold. So you have to tell them this can't be mail ordered, and you tell them what's on the box, and they have no choice but to treat it as the manufacturer has suggested. So some of the where we're getting them from can be just as hazardous as not taking them the correct way. The other thing you need to know is, why are you taking the medicine? What we have learned is some of the old drugs that we decided were really, really bad had positive side effects. So instead of using it for what it either didn't work for or harmed us, we're going to use to help us. For example, there are blood pressure medicines that really don't lower blood pressure very well, but we discovered it blocks testosterone, so we use it for acne caused by testosterone levels. So just saying somebody's taking this medicine or that medicine doesn't mean anything. Mucinex, it's been remarketed. It's basically guaifenesin by a trade name. It was originally used to treat gout because it would bind those uric acid crystals and not go deposit in the joints and be excreted. Didn't work too well, but we discovered that it does have an expectorant in it, acts as an expectorant, so we use it for something else today. We know that antihistamines, like Benadryl and those others, treat nausea as well as allergies. Okay, so just because someone is taking something, you need to understand why you are taking it, because other people will make assumptions as to why you're taking it, and so they don't need to stop it or change it, for that reason. The time of day that you take your medication, very important. We know that cholesterol is released by the liver in the evening to 2 o'clock, 3 o'clock a.m. hour. That's why you take your cholesterol medicine or your fish oil or your whatever at bedtime, so that it blocks how much the liver puts out. Now, if you don't eat a single bite of cholesterol, your body's going to make it. So you can't have a zero, because it basically forms all of the cell walls and all the cells of your body. So we need cholesterol in the right amount. But if you take that medicine in the morning, you may see your doctor increase the dose because he's not getting the effects he wants. So you need to take it at night to get the right dose. The blood pressure medicines can be some of them are used to treat heart failure. They're used to treat your heart rate, and you may not even take it for blood pressure. So you need to understand that they can work both ways. Some blood pressure medicines are used to protect your kidneys. So you don't want to just cross those up as well. Treating blood pressure, you need to understand that there is not one blood pressure that fits all. We used to say 120/80 is this ideal number. What we've discovered is, as we age, we need a higher blood pressure, obviously not too high, and your doctor should be guiding you as to what you want it to be. And that's determined by your risk factors, your age, and lots of other things. So if your blood pressure is 120 over 80, that may be good for you or it may not be good for you, depending on your situation. So please don't go by a certain number. And if you have a question about what that number is, you need to ask the person who is prescribing your blood pressure medicine. When do you need to get concerned? The other important thing about taking medicines is what you're taking together. And we have, in our body, our stomach likes some people better than other people, okay? So, Mr. Bill Loudermilk is married to Miss Ellie Loudermilk. He prefers her all the time. Well, he has a daughter, and he prefers her some of the time. But if it came down to it, he's going to prefer Ellie. Our stomach is the same way. It likes certain compounds, and it's going to take that one before it takes another one. So if you take things like calcium, and antacid of some kind, or a medicine like Prilosec or something for your stomach, your body is going to gravitate to those things. And if you take your thyroid medicine, your blood pressure medicine, you put them all in there together, it's going to take the calcium first, or the antacid first, and so you're going to see your blood pressure medicine not getting the full effect. So what happens, you go to the doctor, your blood pressure is not what it needs to be, they're going to increase the dose, they're going to add another medication, when you could separate those, take them at different times a day, and get more for what you're taking. We have medicines like Pepto-Bismol, aspirin, Bactrim or Septra is an antibiotic, that all have similar compounds, maybe one little bond here or structure there, but you're going to have allergies to, if you're allergic to one of those, you're going to have allergies to all of them. And the food that we eat is very important to know what with your medications. Those of you who have ever taken Coumadin know that you can't eat foods with vitamin K because it messes up those numbers that's needed to thin your blood. Well, there are other things. We talked about calcium. Milk has calcium in it. Orange juice has been fortified now because kids were not, we had bad teeth and bones, so we fortify our orange juice to have a lot of calcium in it. So if you take things with orange juice, you're basically given calcium, and if you take that with your medicines, you're going to have a decrease in effect. Some medications actually make the dose stronger. So you need to know about your medications. Do I take it with food? Do I take it on an empty stomach? Those are two important questions to know about every single medication, because some of these medications are designed to be absorbed with protein, like your meats, and some are designed to be absorbed by fatty foods or cholesterol. So it's very complex today, and sitting down when looking at every one of your medications and the time you're taking them is very important. I really recommend you meeting with your provider or your pharmacist and working all that out. Vitamins, and I'll talk about this for a second. Vitamins, most vitamins are not regulated or supplement. They're considered dietary supplements, a lot of them. The Food and Drug Administration does not regulate those and over-the-counter products like that. So you don't know really what you're taking. And I know you've heard the news where products are being found to have lead and glass and all kinds of things in it because we're bringing them in from other countries not inspected by the FDA. And they can even be made here in the United States not being inspected. If you're going to buy vitamins, calcium maybe, or iron, those kinds of things, you need to look for those products that have the USP, not UPS, but USP label on them. It is the only regulatory body that looks at vitamins to make sure it has the right amount in it, it has the right things involved. So when you buy your vitamins and your supplements, don't go by the cheapest one necessarily. because you don't know where it's being made. Sometimes it's not, they don't have the same requirements to label things that other medications do. So they don't have to tell you what's in it. We've found in energy drinks and other supplements, we've found things, I mentioned lead and glass and some other things. But drugs, prescription drugs, one is called Digoxin, which used to be given for breathing problems. It can cause seizures, heart attacks. There's no regulation of sugar and caffeine in them, and so we see young people dropping dead playing basketball or whatever sport they're playing. There's a young lady volleyball player here in Atlanta dropped and had to be defibrillated on the court. And some of the ones that have died, the young lady had just two energy drinks, 2. They are not regulated. So you need to make sure what you're taking is safe as we can. When we have flaws in the system, but we need to be very careful with what we're putting in our bodies and taking at the same time, because if you don't know what else is in that supplement, you don't know how it's going to react to the other medicines that you're doing. So just be careful about that as far as your vitamins are concerned. Also understand that more is not better necessarily. We think, I'm going to take a multivitamin with iron, with zinc, with magnesium, whatever. The more vitamins, the better, right? No. A lot of vitamins are not excreted by the body easily. So they can, basically you'll get lead poisoning or iron poisoning. Those are metals. If you remember the chemistry table, those are metals. So if you take, and you don't have a level that says you're deficient in these areas, be very careful with the ones that you are supplementing on your own with. Make sure your provider knows what vitamins you're taking, and most of you guys don't. When you go in the doctor's office, they say, what are you taking? And all you list is the prescription medications. You don't tell them you're taking vitamin or echinacea and vitamin C and zinc because it's cold and flu season and we want to boost our immune system. Echinacea prolongs bleeding time. So if you're going to have surgery and you don't tell them, you can have very serious consequences. And maybe you're already taking some blood thinners and we didn't tell that part. So be very knowledgeable about what you're putting in your body and why you are taking it. Just a couple other statements, and we'll take some questions. One thing about blood pressure medications, we talked about what to take it with, but we didn't talk about when we take it. So what we've learned is we used to take your blood pressure medicine first thing in the morning, and it's better that your blood pressure be regulated during the day. Well, when we monitor people's blood pressure during the night, when your body is putting out cholesterol, it's also putting out steroids, cortisol, and things like that into your body, raising your blood pressure. So going that sleep time with nothing to regulate your blood pressure is resulting in damage done to your kidneys, because your blood pressure is high, but you're asleep, you don't know. It's resulting in strokes, lots of bad things. So what some doctors are doing is say you split the dose. Take 1 in the morning, 1 at bedtime. 1 in the morning, 1 at bedtime. So during the evening hours, then your blood pressure is lower, not damaging all the arteries and your kidneys and other things. So before they add or increase your dose, just ask them, if that's something that would be appropriate for you or not. The other thing is about allergies. We have discovered that people are not allergic to things that they think they are. They have intolerances to some of the medications. For example, pain medicine makes me nauseous. That's not an allergy. It's an intolerance. I can't tolerate it. My body doesn't like it. There are certain antibiotics that I can't tolerate, but I'm not allergic to them. So we have to be careful with that and know that a lot of things in our food that we're allergic to are in our medications. If I have a strawberry allergy, Guess what we flavor and color some of our medications with? Strawberries. And the kids like the pink stuff. So we can flavor things and they're allergic to them. What we discovered about milk, the people who say they're lactose intolerant, many of them are not intolerant to the lactose portion. They're intolerant to the cow milk protein. So if we switch them to goat's milk, it doesn't have a cow milk, goat's milk or other types, then they do much better. So you need to, we have come so far, we can get a little further, and we're not just trying to treat everybody the same way. It's very individualized now. If you take antibiotics, you need to ask your doctor about taking probiotics, not needed for a prescription for, to make sure that your gut likes you while you're taking it, right? So you can get some serious intestinal infections, you can get stomach infections, and lots of fungal infections, and I'll just leave it at that. So while you're taking antibiotics, so the probiotics, when you're taking any kind of antibiotics, ask your provider when they're giving you that medication. If you are a diabetic and you need steroids, you need to be very careful and monitor your blood sugar, because the steroids will elevate your blood sugar during the time that you're taking them. So make sure they know what your sugars are running, and it's not just whether you're diabetic, are you controlled or not, because that may change their decision about how to treat you. Some of the antibiotics can change the rhythm of your heart. So if you have heart problems, you need to, when you're prescribed an antibiotic, be very careful and ask those kind of questions. Is this going to mess with my heart stuff? And that's all you have to know. And you have to know all the specific language. Don't know what you're talking about. Ask your pharmacist if you're not sure. Always double check those things. Sometimes the pharmacist will catch it and call the doctor back and say, look, they're on this medicine can cause, this problem, and they'll handle it. But just in case, you need to know these things, to ask these questions. It's your body. You have the right to say no. You're paying for it, right? You have a right to say no. Okay. If you take inhalers for COPD or asthma, bronchitis, you should have a spacer. It allows the medication to get into your lungs, not just the back of your throat. It keeps that, it's an aerosol in that inhaler. It helps keep all that from going out into the air, and it only allows it to go in and taking a deep breath. So we used to only do it for children, but if you go to the hospital, you'll get a blue or, and actually NASA developed that technology. So we're excited about that. The inside, things don't stick to it. It's a vacuum. It's just very important. You can get them. You have to have a prescription for it with your inhaler. It's depending on the kind you get, anywhere from $3 to $20 to have one, and it goes. I mean, it's good for as long as you take care of it. So I just would advise, if you do take inhalers, you need a spacer. Ask your doctor for a prescription for a spacer for your inhalers. Okay. Well, you guys have been a great audience.